From the PIIC Center, infectious disease specialist, Dr. Donna O'Neill. Good morning.
Good morning.
Red, white, and blue.
Trying.
Memorial weekend.
Yeah.
Big
Awesome.
plans?
I work.
Yeah. Yeah, figured. When I was driving by to a soccer game at Northeast School on a Sunday, I told my daughter, I said, that place is open 7 days a week. Dr. Donna's in
We'll
there.
be there this weekend.
And you are. You see patients 7 days a week?
7 days a week, yes. So quiz for you guys.
Oh, good.
Oh, boy.
You missed me, didn't you? So what month is it? Other than May and Memorial Day, the CDC always designates some sort of topic for each month.
Get outside and get active month?
Mental Health Awareness Month.
Hepatitis month.
Oh.
So to bring attention to a few things, they've now recommended that everybody under the age of 60 get the hepatitis B vaccine. And over the age of 60, if you have a risk factor, and the most common risk factors being overweight and having what we call NASH or non-alcoholic steatohepatitis, or the easy name is fatty liver. So
What is hepatitis?
hepatitis is liver inflammation. So do you know where your liver is, Andy?
Yeah, it's right here. Right? It's in here.
Yeah, it's in there.
Yeah, it's in there.
Right upper quadrant. It's a very
Okay.
quiet organ. It's very important because everything you consume and put in your body gets broken down by it. So that's one of the things. And I think they're going to make hepatitis B screening universal like they've done for hepatitis C. Have you had a hepatitis C test?
I've been tested for everything.
Good, because everybody should have one. And the difference is hepatitis C, we can cure it, but hepatitis B can, some individuals, be a chronic disease. So that's the reason for it. And that brings me into one of the hot topics in infectious disease are these children with hepatitis. So it's very, 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 very rare. And I don't think this year the number of cases is going to be greater than other years, but it's gotten a lot of attention. It's worldwide. In the United States, the outbreak was first identified in Alabama, but they haven't had any new cases since February. So a lot of parents are, a little concerned about it. It's hitting kids about 2 years old, so young children. And they're not too sure, what's causing it. They think it's a virus. They think it's the adenovirus, but only about 2/3 of the kids are testing positive for it. So they're looking for a cofactor. And no, it's not the COVID vaccine because these kids are too young to be vaccinated. They're wondering, could it be the COVID infection? But for some of the tests that they've done, only about 20% of them are positive. So pretty rare, but when you read the headlines, 180 cases. What's really weird about it is, although they're finding the presence of adenovirus in the children, like in their bloodstream, they're not finding it in the liver. So they're looking for the cofactors, either medication, something in the environment, other viruses. And it looks like it's going to be an immune response against the virus for some reason. So that's out there, but not very common. I wouldn't worry about it. I think there's one case in Michigan, but they make it sound like, it's everywhere.
But you don't know how you catch it.
Well, a lot of people think it's from this adenovirus, and that gives you typically a GI illness with, fever, vomiting, diarrhea. So there's a lot of unknowns still.
You don't want a GI illness.
No, I don't. No,
We don't want any illnesses.
We've all heard monkeypox.
Yes.
Okay, that's a weird name.
Terrible name.
Terrible
name. Monkeys have nothing to do with it. It got its name because back in 1958, it was first identified in some research monkeys. But the monkeys are not the reservoir. They have nothing to do with it. Terrible name. It has nothing to do with chickenpox, monkeypox, nothing to do, different virus families. Have you ever heard of ORF, O-R-F?
No, but that looks like ORF.
No,
That's
so
the,
ORF is a disease that you sometimes see in people who handle sheep and cattle.
That's the airport code for Norfolk.
So these are some of it has a very characteristic rash.
That's an interesting looking rash.
Well,
Yeah.
it's usually from Africa, West and Central Africa, and the rash is diagnostic. So it starts off with little flat red spots. They get larger, they develop fluid in them, you get that red ring, they get pussy, and then they scab and fall off. Normally it begins with a prodrome, a flu-like illness, fever, chills, aches. Kind of sounds like COVID, doesn't it?
Wow, when Anderson Cooper gets this, he won't even be able to do the show from the basement.
And then you get swollen glands, swollen lymph nodes, and then you get this rash. And this is kind of a full-blown case.
Wow.
So what's unusual is it's hitting lots of countries. So we don't know if it's because of increased travel, is it because of importation of some of these rodents, is it because, you know, we're getting into more rural areas in Africa? So it's, again, it's very, very rare, and it's not transmitted very readily. And
But it's being, they're saying it's being transmitted through sex.
yeah, so there was a case in Massachusetts. The fella had traveled to Quebec in Canada, and there's a big seemingly outbreak there. And so what is different is instead of that usual prodrome and the rash that normally starts from the head and involves the mouth and the eyes, it seems to just start off with swollen glands in the genital area with lesions down there. So, and now we didn't think it was transmitted person to person. Like our last outbreak was related to prairie dogs and handling prairie dogs that got mixed up with these African rodents.
Crazy, isn't it?
So there are some differences with it, but it's not going to be anything like COVID. People ask me about it all the time. So COVID is highly transmissible, just in time for our Memorial Day weekend. And can we see the heat map?
Heat map, COVID.
So Michigan's in high again. This is from NPR. And
So these are the security levels, or the, no, I always confuse
Security
that.
levels, no.
Or risk
our
levels.
risk levels. In
Yeah.
Jackson, we're in the next one, medium. And if you look across the state, you alluded up north, they're in high.
Yeah, look at northern Michigan.
What are you seeing, Dr. Donna, in your office? Are you seeing a little bit of an uptick yourself?
Yes, and typically what I'm seeing, because I'm seeing it because of the monoclonal antibody, we're on our fourth kind of generation of it. And it seems that the older folks are, you know, maybe getting hit hard. So if you haven't had your booster dose, your second booster dose, or a dose since November, it's probably time to, or pardon me, since December, it's time to get another dose. So these individuals come in, they're so upset because, you know, they didn't live for a couple years, they were first in line to get, you know, the vaccine, and now they're starting to do things and they're getting COVID. And some of them are getting pretty sick. I'm kind of seeing changes. So like in January, it kind of looked like Delta, but people didn't lose their smell. And then we had the sore throat where you felt like, you know, you had cactus in your throat, and now more GI. So I don't know if we were, you know, it's amazing how quickly the strains change in the United States. We're seeing, you know, Omicron version 4 or 5 now. It's not clear to me. So the other news with COVID is the vaccine, the booster doses for the kids, and they've changed the recommendations from CDC. Over the age of 50, it was, you may get your second booster. Now they're saying you should get it.
Okay.
So, you know, who wants to get sick, especially when there's a good vaccine? Especially, I think we should, you know, encourage older folks, people whose immune systems are a little weak. I think it depends upon your job, you know, if you're going to be around it. And I think it depends upon your underlying health and ultimately your risk tolerance and what your perception of COVID is. I mean, we do have drugs. I guess that's the other thing. Paxlovid is out there, and there's lots of reports of rebound, and we don't understand why and don't want to hypothesize on that. But, you know, it works, but a lot of people then a week or two later seem to be getting sick again.
Oh my gosh.
Sometimes mild and sometimes very severe.
So the vaccine's been around for 2 years. When is there going to be like a new improved version?
Probably the fall.
Oh.
Yeah, I think I'll probably be rolling up one sleeve for my flu, which will have 4 strains, and my other sleeve probably for COVID, which may have 2 strains.
How are things in Canada with your mother and COVID over in Canada?
COVID's not over anywhere.
Oh, not over COVID.
Over in Canada.
Over in
COVID
Canada.
over
up to
in
Canada.
Up in Canada.
So I think
How's
the
COVID
numbers
up
are
in
going
Canada?
up, and they were heavily locked down, and so there's, you know, we're all sick of it, I know, but their numbers are going up like everybody else.
And allegedly, it's just arriving in North Korea.
Allegedly. And all of a sudden, 2 million deaths.
Yeah.
Yeah.
So it
No one's
seems-
being spared. I mean, Dr. Kack, he says over and over, you know, it's not a matter of if, it's when.
Yeah.
And we have a few COVID virgins still in the office, we call them.
Yeah.
He's one of them. But yeah, very transmissible.
Yeah.
Yeah, very And I'm still amazed that Omicron killed more people than the other. It was the second highest death rate of the COVID surges. And I think that's because it's so transmissible now, very contagious. And I think also we didn't have the monoclonal antibody for it. So again, you want to get that, you know, within 7 days, the pills within 5 days. And I'm there this weekend if you need it.
There you go. It's awesome. One thing Dr. Keck said last time, as we approach Memorial Day, you're more likely to get food poisoning in the summer. So be careful with those dips that have been left out on the picnic table all weekend.
I saw a container of Hellmann's mayonnaise that said no refrigeration necessary.
Oh.
That can't be right.
That's what I couldn't believe it.
Then I think last year we talked about ticks. There's always something.
Yeah.
Yeah.
You won't even eat mayonnaise.
No. No, sir. I have an allergy to that.
So this, I was looking at the news last night and this map, monkeypox, 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 and it reminded me, well, those are the maps we were seeing 2.5 years ago. Are we going to start
No.
to see?
No, it's not going to be anything like COVID. It's not readily transmissible. Yeah, I would not.
Plus,
No, I'll probably be wrong.
No, you're not going to be wrong on this one.
I think what's going to happen, people are going to see the pictures of what you look like when you have monkeypox. I don't, because with COVID, you don't.
Yeah.
Your appearance doesn't change.
Yeah, if you
but,
got that with COVID,
you know, if you-
100%
yeah.
vaccination rate. If you started getting
Yeah, if you
getting
had all
bumps
those
like that.
things, all those blisters and everything all over your face.
Yeah,
you
you'd do whatever you could to get rid
Yeah.
of that.
So I mean, it's a relative to smallpox, which we eradicated, back in 1980. So should remind us of some of our successes.
and it's not lethal.
Some people do pass from it. So there's 2 different strains, but 3 to 6%. And you can get secondary bacterial infections. If it hits your eye, you can go blind. So
What's-
there is some mortality with it.
What's going on at the hospital right now in terms of COVID?
When I don't go there, Dr. Kack does. He says there's about 10 people in the hospital
Okay.
with it, and tends to be unvaccinated. And yeah, so it's not gone.
What should we do to have a safe and healthy summer?
I think it depends, you know, if you're in an area indoors, especially poorly ventilated with a lot of people you don't know, like weddings.
We had a big wedding Saturday.
Huh?
You know, either make sure you're vaccinated. Some people, I'm sure some people will be wearing masks.
Yeah.
You know, so that's okay.
Well, the people
I think
that-
so.
The
That's
wedding,
okay.
the wedding you're going to is postponed twice because of COVID.
Yeah, and I think
So-
it's like in a lot of outdoor area and things like that. But yeah, I think you'll see people just like you do everywhere.
Yeah.
Some people at the mall wearing masks, some people outside wearing masks, some people in their car wearing masks. You just
I don't
you
think
see
you
it
need to
Not too
wear.
many.
You don't
I
need to
see
wear,
that a lot in
Really?
Jackson. Yes,
Okay.
I don't know why that is.
You don't need to wear a mask at the mall because there's no one there.
Well, just depends.
Actually, if you're in a car with someone, cars are a great place to, you know, get COVID.
Yeah.
So if you're I've heard lots of people, they're carpooling, that's how they're getting it. So if they're sitting though by themselves, then
Yeah, that's the one. That's the tricky one for me. But hey,
I see people driving by themselves wearing the mask.
and you know what?
Better safe than
To
sorry.
their benefit, maybe you caught them in between a quick errand, and
Right.
they just didn't want to take the mask on and off again. So, or they're crazy. I don't know. Could be anything.
In the planes.
the planes.
No one's wearing the mask on the planes or at the airport.
Hmm.
I was in line to get through security, and there was a woman, and there was just blood pouring out of her mouth.
What?
Yes.
Jeez.
It's like, I would be more concerned about that than the mask.
But there's some places where masks are required, like up at the Wharton Center.
Yes.
So it's going to be variable.
Yeah. I've been in stores that still do require it.
Yeah. so-
Yes.
Yep.
Yeah.
Well, thanks for
You're
all
welcome.
that you,
Thank you.
bring to us and our audience at each visit. Thanks for coming in.
You're welcome.
Thank you.
Dr. Donna O'Neill from the PIIC Center. We're going to check in with the